Colorectal cancer is the second leading cause of cancer death in Canada. Last year alone, more than 20,000 Canadians were diagnosed with the disease. The Ontario Cancer Plan 2008 to 2011 and the recent launch of a province-wide colorectal cancer screening program demonstrate a strong commitment to preventing cancer. However, real concerns remain regarding access to treatments for the disease. Currently, patients diagnosed with advanced colorectal cancer are being denied access to the standard of care unless they're covered by private insurance or pay for it themselves. Barry Stein is president of the CCAC.
Well, the Colorectal Cancer Association promotes screening programs throughout the country. This is an important first step in Ontario and in other provinces across the country. But that's only half of the program. The other half of the program is that we promote timely access to effective treatment.
The CCAC has launched a public awareness campaign directed at members of provincial governments across the country and encourages all Canadians to get involved and join the fight for equal access to treatment by writing to their provincial MPPs and MLAs at colorectal-cancer.ca.
It's quite devastating to be diagnosed with a stage 4 colorectal cancer. It's kind of a double impact. The impact of knowing that you have a very severe illness, and then the impact of fighting to get the proper care.
Despite being hailed as a standard of care for patients with advanced colorectal cancer, when combined with chemotherapy, Avastin is only publicly funded in British Columbia, Saskatchewan, Quebec, and Newfoundland, leaving the majority of Canadians without access. Dr. Jean Maroon is an oncologist at the Ottawa Regional Cancer Centre.
Our main role as physicians trying to treat cancer patients is to provide the patient with the most effective treatment. It can be very disturbing when we know there is a treatment that is available that is considered standard of care across the world and that we are unable to provide it to our patient because it is not funded. Avastin is one of the new biologic agents that interferes with the blood supply to a tumor, and therefore it interferes with the tumor growth. In combining it with chemotherapy in patients with colorectal cancer, the tumor does shrink and it does improve the survival of these patients.
And I think it's very unfair that on top of that, you have to fight just to get the appropriate standard of care.
Colorectal cancer affects both men and women, with 1 in 14 men and 1 in 16 women expected to develop the disease during their lifetime. If detected early, 90% of colorectal cancer cases are preventable or curable. Sherry Dematarco reporting.